Hey you! Yeah, you, watching this video right now. What if I told you that something you're doing in private could be sending your body a serious warning signal? A symptom so subtle, yet so critical, that ignoring it could mess with your health in ways you never imagined. Today, we're diving into a topic that's rarely talked about openly, but affects millions of people. Masturbation, and the one symptom you absolutely need to watch out for. Stick around, because this could be a game changer for your physical and mental well-being. So, let's get real for a second. Have you ever noticed anything unusual after masturbating? Maybe a physical sensation, a change in your body, or even a shift in your mood that just didn't feel right? Drop a comment below and let me know if you've experienced something off, or if you're just curious about what this symptom could be. I'm reading every single comment, and I want to hear from you. All right, let's dive into it. First off, let's clear the air. Masturbation is a normal, healthy part of life for most people. It's a natural way to explore your body, relieve stress, and even boost your mood. Studies, like one from the Journal of Sexual Medicine in 2016, show that masturbation can lower stress hormones like cortisol, improve sleep, and even support a healthy immune system when done in moderation. For men, it's been linked to a reduced risk of prostate cancer, and for women, it can help with menstrual cramps and pelvic floor health. So, no shame here. This is a judgment-free zone. But here's the thing. Like anything in life, too much of a good thing can sometimes tip the scales. And there's one specific symptom that could be your body's way of waving a red flag, telling you to pump the brakes. That symptom? Persistent pelvic pain or discomfort after masturbation. If you're feeling a lingering ache, a burning sensation, or even a heavy, uncomfortable pressure in your pelvic area, especially if it sticks around for hours or days, it's time to pay attention. This isn't just a random ache, it could be a sign of something deeper going on. Let's break this down. Pelvic pain after masturbation isn't something you should brush off as normal soreness. It could point to a few different issues, and I'm going to walk you through the most common culprits, why they happen, and what you can do about them. My goal here is to arm you with the facts so you can make informed choices about your body. No scare tactics, just straight-up information. One possible cause of pelvic pain after masturbation is overdoing it. I know, it sounds obvious, but hear me out. When you masturbate frequently or intensely, you're putting repetitive stress on the muscles, nerves, and tissues in your pelvic region. Think about it like overworking any other muscle group. If you're doing bicep curls every day without a break, your arms are going to scream at you. The same goes for your pelvic floor muscles. These muscles, which support your bladder, reproductive organs, and even your lower back, can get strained from excessive stimulation or aggressive techniques. A 2018 study in the journal Sexual Medicine Reviews noted that overuse of pelvic muscles during sexual activity can lead to micro-tears or inflammation, causing that lingering discomfort. So, what does this pain feel like? It might be a dull ache in your lower abdomen, a sharp sting near your genitals, or even a feeling of heaviness that makes sitting uncomfortable. For men, it could show up as pain in the testicles or perineum, the area between the scrotum and anus. For women, it might feel like a deep cramp in the pelvic area or even radiate to the lower back. If this sounds familiar, your body might be telling you to take it easy. Another potential cause is something called pelvic floor dysfunction. This is when the muscles in your pelvic floor become too tight, too weak, or just out of sync. Masturbation, especially if it's frequent or involves a lot of clenching, can exacerbate this. According to the American Physical Therapy Association, pelvic floor dysfunction affects up to 25% of women and a significant number of men, though it's often underdiagnosed. The symptoms? Pain during or after sexual activity, difficulty urinating, or even constipation. If you're noticing these alongside pelvic pain after masturbation, it's worth checking in with a healthcare provider, like a urologist or a pelvic floor physical therapist. They can assess whether your muscles need some TLC, like targeted exercises or relaxation techniques. Now let's talk about something a bit more serious. Infections or inflammation. For men, excessive masturbation, especially without proper hygiene, can sometimes irritate the urethra or prostate, leading to conditions like prostatitis or urethritis. Prostatitis, which is inflammation of the prostate gland, affects about 8.2% of men at some point, according to a 2017 study in the journal Prostate Cancer and Prostatic Diseases. Symptoms include pelvic pain, burning during urination, or even discomfort during ejaculation. For women, irritation from frequent masturbation, especially with toys or without enough lubrication, can increase the risk of urinary tract infections or vaginal irritation. If your pain is accompanied by symptoms like fever, unusual discharge, or a burning sensation when you pee, you need to see a doctor ASAP. These could be signs of an infection that needs medical attention. Another angle to consider is nerve irritation. Your pelvic region is packed with nerves that are super sensitive to pressure and stimulation. Overzealous masturbation, especially with a rough grip or intense devices, can irritate nerves like the pudendal nerve, which runs through your pelvis and controls sensation in your genital area. Pudendal nerve irritation can cause persistent pain, numbness, or even a tingling sensation that doesn't go away quickly. A 2020 article in the journal Pain Medicine highlighted that repetitive mechanical stress, like aggressive sexual activity, can aggravate this nerve, leading to chronic discomfort. If you're noticing numbness or tingling alongside the pain, it's a sign to slow down and give your body a break. Okay, let's pivot to something less physical, but just as important, your mental and emotional health. Masturbation is often a stress reliever, but if you're relying on it excessively to cope with anxiety, depression, or boredom, it can start to backfire. This brings us to a less obvious but equally critical aspect of that pelvic pain. It might not just be physical. If you're feeling guilt, shame, or anxiety around masturbation, those emotions can manifest as physical tension in your body, including your pelvic area. A 2019 study in the journal Psychology of Addictive Behaviors found that compulsive sexual behavior, including excessive masturbation, can lead to psychological distress, which sometimes shows up as physical symptoms like muscle tension or pain. If your pelvic discomfort is paired with feelings of regret or loss of control, it might be worth reflecting on your habits and even talking to a therapist. So, what should you do if you're noticing this symptom? Step 1. Don't panic. Pelvic pain doesn't always mean something catastrophic, but it's your body's way of saying, hey, let's check in. Start by taking a break, yes, a full break, from masturbation for a few days or even a week. This gives your muscles, nerves, and tissues a chance to recover. During this time, pay attention to when the pain happens, how long it lasts, and whether it's getting better or worse. Keeping a journal can help you spot patterns. Next, focus on moderation. There's no universal right amount of masturbation, but if you're doing it multiple times a day and feeling pain, it's probably too much for your body. Try scaling back to once or twice a week and see if the discomfort eases up. Also, be mindful of your technique. Using too much force, not enough lubrication, or even gripping too tightly can contribute to irritation. For women, using a water-based lubricant can reduce friction, and for men, loosening your grip or switching up your method might help. Hygiene is another biggie. Always wash your hands, genitals, and any toys before and after use to prevent irritation or infection. If you're using toys, make sure they're made of body-safe materials like silicone or glass and clean them thoroughly. For men, peeing after masturbation can help flush out any bacteria that might have entered the urethra. These small habits can make a big difference. If the pain persists for more than a week or two, or if it's getting worse, it's time to see a professional. A urologist, gynecologist, or pelvic floor therapist can run tests to rule out infections, assess your pelvic muscles, or check for other underlying issues. Don't be embarrassed to bring this up. Doctors hear about this stuff all the time, and they're there to help, not judge. Be honest about your symptoms and habits so they can give you the best advice. While you're addressing the physical side, don't ignore your mental health. If you feel like masturbation is taking over your life or causing distress, consider talking to a therapist who specializes in sexual health. They can help you explore whether your habits are compulsive and offer strategies to find balance. Cognitive behavioral therapy, for example, has been shown to help with compulsive behaviors, according to a 2021 study in the Journal of Behavioral Addictions. Let's talk prevention, because the best way to deal with this symptom is to stop it from happening in the first place. Build a routine that includes other stress relievers like exercise, meditation, or creative hobbies. These can reduce your reliance on masturbation as a go-to coping mechanism. Pelvic floor exercises like Kegels can also strengthen those muscles and improve blood flow, which might help prevent discomfort. Just don't overdo the Kegels. Too much clenching can actually make things worse, so follow a guide from a physical therapist. Another tip: stay hydrated and eat a balanced diet. Dehydration and poor nutrition can weaken your pelvic muscles and make you more prone to inflammation. Foods rich in omega-3s like salmon or walnuts and anti-inflammatory foods like berries can support overall tissue health. It's not a cure-all, but it sets a solid foundation. Let's wrap this up with a reality check. Masturbation is a normal part of life, and for most people, it's totally safe and beneficial. But your body is always talking to you, and persistent pelvic pain is a signal you shouldn't ignore. Whether it's overuse, an infection, nerve irritation, or even stress, this symptom is your cue to pause, assess, and take action. You deserve to feel good, physically and mentally. So don't let embarrassment or stigma keep you from addressing this. Before I go, I want to hear from you again. Have you ever experienced pelvic pain or discomfort that made you rethink your habits? Or maybe you've got a question about something I covered today. Drop it in the comments. I'm reading every single one. If this video helped you, give it a thumbs up and share it with someone who might need to hear this. Subscribe and hit that notification bell so you don't miss my next video, where we're tackling another health topic that no one's talking about, but everyone needs to know. Until then, take care of yourself. You're worth it.